So 18 years ago, actually 19 years ago, I was working with adolescents at university, college, and in a youth agency. Very different young people. But the young people who did come to see me were clearly in need of support and help, but they wanted an immediate answer. And in many of the occasions, there was no immediate answer to the pain that they were feeling, to the worries they had, and it felt as though much of the way they were managing their life had to do with early life experiences. And it felt too late. So I thought if only we could reach children sooner rather than later, we could have a much longer term impact on the emotional health and mental health of young people. What makes Place2Be services unique? The service started out in 1994 when we got charitable status as a counselling service. Now it's much, much wider than that. What makes us unique is that we actually know, we have a practical experience and have learned from practical experience of how to embed our services within the school. Schools are our partners. We're not an add-on, we're an integral part of the school. And over the years, we've developed a range of services to support the emotional needs of children in many different ways, to support teachers in their understanding of children and their emotional needs. Not that they don't know it, but we bring in a different skill and then support the parents. So it's a whole school, whole community model, which makes us unique. What has been the key turning points? The key turning point initially was to embed research in our veins. So having the courage to use research and evaluation to highlight what we needed to learn. So that is what helped us develop our model in the early stages. And then the key turning point was working with KPMG in 1997 when we looked at how we could become a national organisation with quality central to our thinking. 1999, when we started our national dissemination programme and learnt a huge amount of that. Rewind slightly, 1998, when we got funding from the Department of Health to develop what is now our foundation course, so we could provide training to very skilled adults in the community who had no therapeutic skills but had life understanding, which is now the foundation. And then in 2002, when we started our dedicated parent counselling work. So those are, for me, key milestones. And then the PG, DIP and Masters. So it's very important to identify unit costs and whether we are cost effective, because why on earth would first of all, our clients engage us and pay for us unless we could demonstrate that we were cost effective? And why would businesses and statutory funders fund us if we were wasting their investment? So 3 years ago, we looked at unit costs, and we now have we now have the results. So we know that it costs significantly less than other organisations, and we know that for every pound spent, there's a return of £6. Those are all terribly important financial statistics. The challenges are the same as they've always been. How do we maintain quality? How can we really be convinced that we are having the greatest impact on children? So the challenges will remain the same in national quality, engaging and recruiting the volunteers who are so vital to everything we do and providing them with the support that they need and the training that's needed, to provide the support that we need to maintain our school project managers in delivering the quality that they need, and our hub managers and regional managers. So it's staff development, and the key challenges is of course funding. How do we pay for the service that is so vital to so many schools? One of the first stories that helped me realise the true impact was when we first began our national dissemination programme in 1999. We extended our reach into Brent, and one of the head teachers in an infant school said how there had been a little girl who'd been elected mute for quite a long time, and she had been referred to the Place2Be, and at the end of that school year she stood up in assembly and spoke, and that not only moved the head teacher, but that was fantastic to hear that. Then there was another child in another part of England who was referred to the Place2Be because he was very angry. And we didn't think that the impact of the one-to-one counselling was going as well as we would have hoped, and we couldn't quite understand what was going on until we discovered that he was living in a car with his mother, who had been rehoused, but because she had a long-term issue with drugs, was concerned about going to social care to find out what had happened to her rehousing. And so she engaged with the Place2Be and then took up parent counselling support through the Place2Be. And now they are housed, she's in healthy recovery, and he's in school and he's progressing extremely well. There are hundreds of stories. There's another little girl who was in care and was waiting to be adopted. Eventually she was adopted and her adopted mother got cancer, and so she was having a whole string of losses and problems and attachment issues, and now she's actually well established and in a secondary school and thriving. So those are some of the stories. I'd like the Place2Be to continue doing what we do well, but more of it. So I'd like to be in more schools. I'd like to have more evidence of the impact, both the emotional impact of our services as well as the academic attainment impact, the impact on academic attainment. And I'd like to see a much larger workforce trained by the Place2Be, because the needs, the emotional needs of children are huge. We need to be in more places and we need more people to be able to deliver it.